Every time we hear the music, and we're in this love together, we got the kind that lasts forever.
Hi, everyone. Welcome. We are streaming live on Facebook. So if you're on Facebook and you're a PWNer, come on and jump on. Get to PWN's page because we're about to start a live broadcast just for you and anyone else who wants to watch because it's live on Facebook. But basically, we're going to be answering your questions. A lot has been going on in the policy world and in just the world generally with the things that are happening with COVID-19. And we've been hearing a lot of questions from members, especially around like what's going on with that huge bill that passed, $2 trillion, lots of complexities. So we're here to try and help break it down a little bit. Also joining us is Jessica from In Our Own Voice, and I'll let her introduce herself to you in a little bit. But for now, just jump on over. We're really excited. And, we're all in this together. So let's come on over here. Let's get some good information sharing ready. All righty. Hi, everyone. Hi, Facebook world. Welcome, welcome. I'm really glad to see you all. Super excited. So let's go ahead and get started. Online right now, you have Kelly and Brianna from PWN and Jessica from In Our Own Voice. And we're here because a little while ago, a couple of days ago, we asked PWN members to submit questions that you all had. Bill, the big stimulus package that was passed. And so we're here to answer those questions and then to get more live questions from you. So basically what we're going to do is the ways that we've structured this is that we have collected some questions. So we're going to go through those. Bree and I are going to answer some general questions, and then all three of us are going to really dig into some of the policies from the COVID-19 stimulus package. And then we're going to open up some space for you all to ask any questions that you might have still lingering. So from there, I'm going to ask all of our folks online who we're going to be having a nice little conversation with, just to introduce yourself. So my name's Kelly. I am the legal fellow with PWN, and I am living in Berkeley, California. My pronouns are she, her, hers.
Awesome. Thank you, Kelly. Yeah, so my name is Brianna Diaz. My pronouns are...
Bri, I can't hear you.
I'm not muted. I'm not muted.
Oh, okay.
Can you hear me?
Yeah, I can hear you. Yeah.
Okay. I can't hear anyone. That's okay. Go ahead, Bri, introduce yourself.
This is fun now. So my name is Brianna Diaz. My pronouns are she, her, hers, and I am the policy director for the Positive Women's Network. And I am in Richmond, Virginia currently.
Figured out technical difficulties on my end. Thanks, everyone.
Good afternoon, evening, everyone. My name is Jessica Pinkney. I'm the Vice President of Government Affairs for In Our Own Voice, National Black Women's Reproductive Justice Agenda. My pronouns are she, her, hers, and I am based in Washington, D.C.
Awesome. Thank you so much. All right, so we're actually just going to dive right in. I do want to encourage you as we're talking and questions start popping up for you, if you just put them in the chat box. Right now we have Ebony who's monitoring the chat box and is going to let us know whenever questions come up. And then as we're talking, if resources become, if you want us to share some resources and we can do that, we will share those resources. So to start us off, Brianna, can you just talk about, is coronavirus and COVID-19 the same thing?
Great question. Coronavirus or coronaviruses are a large family of viruses that cause primarily respiratory illnesses, ranging from the common cold to life-threatening pneumonia. COVID-19 is the name of the illness caused by the new coronavirus that we're seeing that was first documented in Wuhan, China in December 2019.
Okay, thank you.
So my question for you, Kelly, is are people living with HIV at higher risk for getting COVID?
Yeah, so that's a really good question. And this is one of those questions that's a little tricky to answer right now because not much data is available on COVID-19 and people living with HIV. But based on what we do know, it doesn't appear to affect people living with HIV differently than other folks. But I will say that because there's not definitive evidence to support this, and until we know more, people living with HIV, especially those who are already at higher risk for having a serious COVID-related illness, so those who are older or who have advanced HIV or poorly controlled HIV, as well as if you have other conditions like heart or lung disease or diabetes, you should be extra cautious. And one of the nice things is that PWN, along with a host of other organizations, actually put out an FAQ that includes this question. So like I said, information is developing and we're learning more things about COVID-19 and the new coronavirus every day. And so as we learn more about how people living with HIV are impacted by COVID, we're going to be updating that resource. So check that out. So Brianna, let's say a person living with HIV wants to see a provider right now. Can they do that?
Yeah, so great question. Many healthcare providers right now, including HIV service providers and healthcare providers, have switched over to telephone, telehealth, or video visits with their patients, so they do not have to come into the clinic. So if you are not feeling well and you need to see your healthcare provider in person for your protection, it is critical that you call your provider before actually going to your clinic.
Awesome.
Yeah, so then, Kelly, what do I do if I think I have, COVID-19? We've heard a lot that local clinics might be telling our membership to go to the ER, but then they'll call the ER and the ER says stay home. So can you clarify what we should be doing?
Yeah, that's a hard one. So there's some guidance that we've gotten CDC about when you should be calling your local clinic and asking about what to do. And so basically, if you have shortness of breath or fever or cough, or if you've recently contacted someone who you know who's had those symptoms, so shortness of breath or a fever or a cough, you are going to want to try to talk to a nurse, a doctor, or some other healthcare professional as soon as possible. But you're going to want to call. So you're going to want to call before you plan to arrive at a doctor's office or an emergency room and tell them about your symptoms. This is so that they can sort of do that cost benefit analysis of whether it's important for you to go there in person or to stay home and protect yourself as much as possible at home. So right now there is an infographic from Johns Hopkins University, and I'm going to ask Ebony to put that in the chat box. So hopefully you can look at that. It's a really good reference about when it's important to go seek medical help. So a similar question to you, Brianna. So is there anything in place to support someone who might want to go get a test for COVID-19 or the coronavirus, but are scared to go? Oh, yeah. Actually, I'm going to answer that question.
Okay, go for it.
Yeah, I'm going to answer that question and not in a terribly satisfying way. I apologize for that. So a lot of the testing protocols are really going to vary state by state, and they could even vary within local jurisdictions. As a general rule of thumb, if you're having those symptoms that we talked about before, you should call your state or local health department or doctor to see if you can go get tested. If you are very nervous, there are some states that have drive-up testing. So if you want to find out if that's one of your states, you should contact your state public health department to see if that's you. But right now, the truth of the matter is that tests are limited. And even some of the drive-up testing facilities are limited, to example, for people who are high risk or healthcare professionals or first responders. So not everyone can be tested. So we really encourage you to call first. Now I actually am asking a question to you, Brianna. We've heard from a couple of members that they're hearing a lot about racial disparities in COVID-19 related deaths. So how do they find out that information in their state?
Yeah, no, that is a great question, and one that is like very heavily discussed right now. Unfortunately, access to that kind of data, the racial disparity data on, who is getting COVID-19 and what are the death rates, that is going to vary state by state and even city by city. As of now, less than a dozen states publicly share COVID-19 data that is desegregated by race and ethnicity. And this is a huge issue, considering that like by not releasing this information publicly, states and the federal government can try to keep ignoring how inadequate and unjust our public health responses are. And so, our members at the local and state level, you all do have the power to check into this to see if your state has released this information. And if they haven't, demand it. And that doesn't mean only mortality data. We need to know who is getting tests. We need to know what is the breakdown of cases of COVID-19, who is getting access to the care. All these questions you can have answers to by submitting a public records request. You can also write letters to your state public health department, to your state governor, or even to the Secretary of the U.S. Department on Health and Human Services. And we are always happy at PWN to help draft those letters and connect you to the people who should be receiving them. So, Kelly, back to you for real. How is this pandemic affecting the HIV community?
So as I said in the earlier question, right, there's a lot that we don't know, and getting the statistics of the percentages of people living with HIV who are either testing positive for COVID-19 or the mortality rates of folks living with HIV for COVID-19 related deaths, we don't have that information. Like Brianna just said, we're still really struggling to get data that's disaggregated by like characteristics like race or ethnicity. And so this is something that we need. And we're going to keep updating you as more information becomes available. So those were the questions that we received ahead of time for some folks from PWN, more generally about COVID-19. I'm going to pause right now because I know Jessica and Ebony, Jessica Carter, sorry, who is our organizing director, have been monitoring the chat on the Facebook Live. Jessica, are there any additional questions that have to do with sort of the topics we just covered? Oop, I can unmute you. Oh, maybe you should, there we go.
Yeah, okay, sorry about that. Yeah, I don't have any so far on my end. Ebony might have some, she's doing the live stream portion.
Okay, great. Well, if you get any, we're going to take another pause after we dig into the sort of policy questions that we've already gotten. Okay. Thank you so much. All right, so we're turning to more policy-oriented questions right now. And Jessica, this one's for you. So what is the CARES Act?
Yeah, so the CARES Act is the Coronavirus Aid, Relief, and Economic Security Act, and it's a $2 trillion with a T coronavirus response, or the $2 trillion coronavirus response bill, which the House and Senate passed a few weeks ago now and was signed into law by the president, which is supposed to help provide relief to our economy. So this was actually the third package that Congress passed as it related to coronavirus, but absolutely the most robust and the one that is impacting all of our lives day in and day out most directly right now. And I think the one that people have the most questions about. It was designed to help keep individuals afloat, to help small businesses, and to ensure that we would be able to kind of sustain ourselves throughout this pandemic.
Thank you. Yeah, so we're gonna keep talking throughout the rest of this a lot about like what was in the CARES Act and how is it gonna impact you. And so one of the things that we heard, okay, so we put out a call for questions, and I have to say at least half of the questions I think had to do with the stimulus checks. And so Brianna and I are going to do a quick like back and forth trying to get these questions down, because we want to make sure you have the information that you need so you know what's coming your way and about when. And so we're going to start with you, Brianna. So just like, what's going on with the stimulus checks? Who's going to get one and how?
What a great question. Like, this is such an important question for so many people. So based on the CARES Act and information released by the respective agencies in charge of providing these checks to people, it looks like those who get them are U.S. citizens and resident aliens who have a valid Social Security number, people who could not be claimed as dependent of another taxpayer, and those that have had an adjusted gross income under certain limits. And so these are like the numbers y'all have probably seen a lot already, where it's like a single adult whose reported adjusted gross income is $75,000 or less on their 2019 tax returns. Those people get a one-time check for $1,200. Married couples who filed jointly will receive $2,400, a check for $2,400, and families will get an additional $500 for each child under 17. You want me to keep going about the taxes part?
Let's see. So we'll probably cover that, and then if we don't, then we'll jump back to it.
Great. Okay.
Yeah, great. So the big question I think a lot of people have is, when am I going to get my stimulus check? Like, everyone wants that. So I have some good news for you out there. Stimulus checks could be sent to some taxpayers as early as last Thursday. So that's April 9th. And provided your direct deposit information to the IRS, then your check might have already been sent and could arrive as early as April 14th. But that's not all of us, because some folks didn't submit their direct deposit information, some folks didn't file taxes, and we're going to get into all of those complications. But you should know that the IRS is going to start sending paper stimulus checks on April 24th. And so those are going to be sent to people, the people with the lowest income first. And so those will be slightly more delayed because the mail takes a little bit and it takes a little longer to cut a check than it does to use direct deposit. So what about paying this back, right? Is this a loan from the government that we're going to have to pay back? Will we ever have to pay it back?
No to either of those things. It is not a loan. You do not have to pay it back. You do not have to report it in your 2020 or 2021 tax return. It's yours. It's not taxable income. It is not a loan. Keep muting myself. So then, Callie, is it true that people who get Social Security are going to get part of the stimulus money?
It is true. Now this one's a little bit complicated, and we actually have like 3 questions that are related to this, right? Because we have Social Security that you get, like retirement Social Security, but then you also have SSDI, Social Security Disability, and SSI, Supplemental Security Income. And so things are going to be a little bit different for SSI and VA benefits. We're going to get to that. But for Social Security generally, yes, if you didn't file taxes, but you receive Social Security benefits, you don't have to file any taxes to qualify. That's because the IRS, so they're going to look at your 1099 benefit statements to get out the checks. So you're going to you should automatically receive that stimulus check. And if right now the government doesn't have your direct deposit information, you can actually give that to them to try and expedite the process. Like we were talking about before, it takes a little bit longer if they don't have that info. So now we're going to go over some of the slight complications around SSI and veterans benefits. So Brianna, are people who get SSI benefits receiving a stimulus check?
So yes, as Kelly said, if you receive SSI benefits, you will be getting a stimulus check. Right now, the IRS has indicated that if you receive SSI benefits, you do not need to file taxes or fill out an application in order to receive your check. You should receive your stimulus check based on the 1099 form, as Kelly mentioned. However, if you're on SSI and you don't get a 1099 form, you will need to file the non-filers application in order to receive the stimulus check. And this application exists on the IRS homepage that provides all like COVID-19 related questions to your stimulus check. And we will provide a direct link to that application, probably somewhere in the chat, but we have it to share.
Yeah, Ebony, if you could put the non-filers enter your information here application into the chat, that's what Brianna's talking about there.
Yes, and that is only if you do not fill out a 1099 form. If you are an SSI beneficiary and you do have a 1099 form, you should not have to do anything to get your check. Awesome. So, Kelly, what if you're a veteran receiving veteran benefits only, but you don't receive Social Security disability? How can you get the check?
Okay, great. So you're receiving veterans VA benefits, VA disability compensation. So you're eligible, even if this is your only source of income. For most folks with veteran benefits, the IRS is going to automatically process your stimulus checks. However, this is one of those, if you haven't filed a tax return, maybe your income is too low and you don't receive Social Security benefits, you are still going to need to file that non-filers enter your information here application in order to receive your stimulus check. You can also file a simple tax return. So the IRS did push back the tax filing deadline for 2019. Normally, we would have had to get our taxes done by April 15th, but because of all of these things that are going on, the IRS did push that back to July 2015. And so if that's you, if you're like, I'm going to just file my taxes, there's also a free file program through the IRS for folks who make $69,000 or less. But if you are filing that non-filers enter your information here application, I want to really let you know that it is not very difficult to fill out. You just have to give the government some basic information so they know about you and why you're getting this check. So encourage you to do that. So we're hearing that there are folks who will get the stimulus check. What are some things that could stop someone from getting one?
There's a lot of stuff. A big issue that we're seeing already, we saw prior before the CARES Act even became law, is how are people that who are homeless or have unstable housing going to have access to their checks? Because depending on the factors that we discussed earlier, they will more than likely, they're supposed to receive a check. There are also people who may not have bank accounts for very obvious reasons. Sometimes it's expensive to have your own bank account to maintain that. A lot of big banks charge service fees just to have an account, right? So people don't always have these things. And as part of getting your check, you either need to provide your home address and or the routing number to a bank account you may not have. And so that's already one big issue we're seeing. I know that there are some alternatives to receiving your check. So if you qualify for a stimulus check, but you don't have a bank account, an application like the Cash App actually does provide a routing number, so a direct deposit number that you are able to provide to the IRS in order to receive your check. However, that is not the best solution. That also comes into an issue with, who has access to cell phones. There's a lot of issues with access here. And unfortunately, the bill does not do an adequate job at addressing these shortcomings for a lot of marginalized populations. And it places the burden on these people to step forward and connect with those that can provide them with the information and tools necessary for them to get their checks. So, there is no, like, there's no really great answer here. I think there's just a lot of community mobilization and organizing that needs to happen around this issue to ensure the most marginalized members of our community have access to the money that they're entitled to.
Awesome. Thank you so much. And I see a question in the chat that is directly related to the checks. So I'm going to just ask this right now. And it's, what if you worked, filed taxes, and receive SSI? Would you still be able to get your check? And the answer to that is yes. So as long as the government should at this point probably have your direct deposit information, or they'll be mailing you a check if you filed in 2018 and 2019. All right.
Great.
So we went over, right? So you do have more time. The next question is, if I had more time to file, what's my deadline to apply for stimulus checks? Remember, you don't really need to apply. The IRS is going to be processing that information, but you do have time to file taxes, and that's until July 15th. What if, Brianna, you didn't file taxes last year, or maybe even in the last 5 years? Can you still get the stimulus check?
Yeah, if you didn't file taxes in, however many amount of years, you may still get one. The IRS has a non-filers application that I mentioned before with the SSI beneficiaries, where you may fill out this application to receive your check if you fall under one of these two requirements. The first one is, if you did not file a 2018 or 2019 federal income tax return because your gross income was under $12,200 for an individual, or $24,400 for a married couple, and this includes people with no income. If you fall under one of those designations, you may fill out this IRS application to receive your stimulus check. The second group of people who may not have filed taxes but still may have access to the checks are if you weren't required to file a 2018 or 2019 federal income tax return for other reasons. And those other reasons are like what we mentioned earlier, veterans, I think it was like railroad retirees, and SSI beneficiaries. Those groups of people are not required to file an income tax. So they do not need to do so now in order to receive the stimulus check.
Cool. Thank you so much. Since we kind of already answered my next question, that like folks are still eligible to file taxes, instead I'm going to field one from the Facebook Live. So this question is, what if you moved from the time you filed a 1099 for your pension benefits? Would a stimulus check go to your old address or to the new address that you provided with your pension company? So for this one, and please correct me if anyone knows differently, my understanding is that if it's on your 1099, it will probably go to your old address unless you have a direct deposit, in which case straight into the bank account. So what I would recommend doing is going on to the IRS website and making sure that you update your address there so that they send it to your new address. All right, so Brianna, if someone qualifies for a stimulus check based on the 2018 tax return because they have yet to file a 2019 return, but the 2019 return would disqualify them, are they going to have to give back that money?
I feel like I'm in school again with these questions, Kelly. I love the way that they're framed. So the answer to your question, I think, just to reiterate, as Kelly said, the federal tax return date has been pushed back to July 15th. And so the IRS has asked you to file your tax return as soon as possible, hopefully to respond to this issue that the question presents. However, if you haven't filed a 2019 and the 2019 would have disqualified you from receiving the full $1,200, no, you don't need to return the payment. An example of this problem could look like, you're an individual with no children. You made $60,000 in 2019. So therefore you would qualify for the full $1,200 stimulus check. But then in 2020, you end up making $8,500, which puts you out of, you're in like a phase out range, which means that you get less than $1,200 because you make $85,000. So you would only be eligible for the $700 check, not the $1,200. But you already received the $1,200. So do you need to pay back those $500 that you made? No, you don't. You keep the full $1,200.
Okay. Awesome.
Yeah. Cool, Kelly. So my question for you is, if I'm an essential worker and still working, do I qualify for a stimulus check regardless of how many hours I work? And does the agency have to complete any application or documentation for their staff to receive checks?
Yeah, good question. So the agency doesn't have to do anything. Assuming you filed taxes in 2018 or 2019, the checks are going to be automatically processed. The flag I want to have on this question is it says, regardless of how many hours I worked. Remember that if you're a single person and you're making more than $75,000, the amount you're going to get is going to decrease incrementally, like Brianna described a little bit before. So it's not regardless of how many hours you work, because that might change your income level. Brianna, so this is a big one. A lot of folks are asking in the chat, like, what if they owe money? So will you be able to get a stimulus check if you owe taxes?
Yeah, so the answer is probably. Even if you owe money to the IRS, you should be able to get a check. There is one exception, and that is if you owe child support. If you owe child support, and the state has referred that to the US Department of Treasury, so like the US government's on notice that you owe child support, then your stimulus check can be taken to start paying back what you owe.
Yeah.
But if you have like a student loan or something like that, no, like your money does not go, your $1,200 check or just stimulus check generally will not go to paying back that loan. Cool. So Kelly, are people who are on public assistance or welfare receiving a stimulus check?
Yes. Yes. Being on public assistance isn't going to impact your ability to get a check. Simple answer. Brianna, if someone usually goes to the IRS building to file, how do they get help if they're disabled, if they're blind or deaf?
Yeah, no, this is a great question. And from what I found, it looks like special assistance is available for persons with disabilities. If you are unable to complete your tax return because of a disability, you may be able to obtain assistance from an IRS office or a program called the Volunteer Income Tax Assistance or the Tax Counseling for the Elderly programs. Both of these programs are sponsored by the IRS. However, due to COVID-19, a number of volunteer income tax assistance sites and all of the tax counseling for the elderly sites are closed for an undetermined amount of time. I can say, for example, I was looking, I live in Richmond, Virginia, and let's say I needed assistance filing my 2019 tax return, and I needed to get to the closest volunteer income tax assistance site to file my 2019 tax return. That is unfortunately 25 miles away from me, and now requires an appointment because of COVID-19 concerns, right? So technically, you should be able to access a site that is still open, close to you via an appointment. However, based on what we have seen, there are a lot of issues with accessibility. And to my knowledge, I'm not exactly sure like what mobilization is going around this issues to connect members of community to these sites. So it looks like there's a lot of work that needs to be done on this issue.
Yeah, thank you. Okay, so from there, that was a lot on the stimulus checks, but the CARES Act did a lot more than stimulus checks as well. So we want to make sure we're talking about some other things that happened. So Jessica, this question is for you. Do all of the state's normal requirements for eligibility for unemployment still determine eligibility during the pandemic?
Great question. So the CARES Act really did a lot around unemployment, and so I'm going to dive into a little bit of that to answer this question. So the CARES Act offers larger unemployment checks for a period of time, increasing the duration of those payments, and extends benefits to previously ineligible groups of workers, including folks in the gig economy, and people who are freelancers. So the legislation offers an additional 13 weeks, about 3 months, of unemployment insurance, and provides about $600 a week additionally for up to 4 months. And this would be in addition to the current benefits offered by your individual state, which often administer their own unemployment insurance programs as well. So it really does differ state by state, and that is important to lift up. There is a link here where you can get additional details about the unemployment benefits in your particular state. But I want to just note that the requirements for eligibility are dependent on your prior wages and, like I said, the state in which you live. It's common that states will base their payments on the worker's prior 4 quarters of wages. So you should expect to have to provide that information if you have it. And furloughed workers can also collect if they're temporarily laid off. So that is something new in the stimulus package that I think is important to lift up. And then, as I said, the legislation does extend benefits to previously ineligible workers. So this includes self-employed folks, people who were seeking part-time work, those who can't reach their place of work because of the COVID-19 pandemic, individuals who don't have a sufficient work history to otherwise qualify for benefits, and those who quit their job as a direct result of COVID-19. So like I said, the resource that I hope is being shared in the chat box can help you kind of decipher what the requirements are in your state. But there have been a lot of changes to unemployment insurance in this time, and so it really will vary state by state on how those benefits are being administered.
Thank you. And that resource is really, really helpful. So I hope you all will check it out to find out what's going on in your state. All right. So the next question is one for me. And so this is, how long are student loans going to be suspended for? And it's really appropriate that this question comes from me because I have a ton of student loan debt. So thanks to the CARES Act, the government is automatically suspending payments and waiving interest on federal student loans for 6 months. So that's up until September 30th. The Department of Education also announced that there's going to be waivers implemented retroactively to March 13th. So basically, if you've made a payment since March 13th, what you can do is reach out to your loan provider and request a refund. Now, I do want to emphasize that this is federal student loans. So if you have private student loans, they're not included in that forgiveness program, but you can reach out to your private student loan provider because some of them are still offering some kind of relief. So I encourage you to do that.
Can I add something there, Kelly?
Yes.
The other thing I would note is if you are in the public service loan forgiveness program, even though you're not making payments during the 6-month period, it will count towards your 10 years of eligible payments for public service loan forgiveness. Yes, very exciting little detail.
Very cool. Now I have a chat in the chat box that I think Brianna can field. So Brianna, the question is, are there any Hopwood dollars for the states in the CARES Act?
Yes. Yes, there was an additional $65 million allocated to HOPWA in the CARES Act.
Awesome. Thank you. Jessica, this one's for you. So how are SNAP and TANF change?
Sorry, you froze for a second, but I know the question. So unfortunately, the CARES Act did not increase the SNAP benefit, or there was a TANF emergency fund that existed in previous recessions that a lot of folks were hoping would be implemented again during this crisis, and it was not. So the CARES Act does lack a SNAP benefit increase, which is really needed, as we all know, to help families afford food. The TANF emergency fund that has existed in previous recessions would help provide families with children and others with cash assistance, the ability to meet their basic needs. And this is something that many organizations, I imagine both of ours included, are advocating for to be included in future COVID legislation, because we know that Congress wants to do more to ensure the safety and security of families. But this is an area where the current legislation is significantly lacking. And so we do imagine that we're going to see and are already seeing stress be put on these programs to be able to provide.
Thank you so much.
Mm-hmm.
So there's a question that's been coming up in the chats a couple of times, so I just want to address it now. And I'm going to see if any of our folks online want to have a say in this, but a really hard question of how does someone shelter in place if they're experiencing homelessness or housing insecurity?
Yeah, unfortunately, I really wish I personally had a better response to this question. I know that, so I'm originally from Southern California, and I was actually speaking with some family yesterday, and they were sharing that the local convention center in San Diego has become a COVID homeless shelter. And so everyone is separated, I think, by 10 feet, and they're not turning anyone away. So I think it's really going to vary state by state, because some folks have more significant shelter in place requirements than others. But given the fact that a lot of the stadiums and convention centers and things like that are closed for public events, I think a lot of cities and states are trying to open those up to our housing insecure population to help. But I unfortunately have not seen as many resources in this area as I would hope to.
Thank you so much. This is a hard question. I'm going to ask Ebony to put 2 links into the chat box for you all. So one is a resource to find out where tenant protections have happened or where rent strikes are happening to try and push for better policies to protect those who are either experiencing homeless or who have unstable housing right now. And then the second one is called Just Shelter. And so Just Shelter really compiles, there are hundreds of organizations right now that are working really hard to preserve and bolster things like affordable housing, to prevent evictions and reduce homelessness. And so this resource lets you search within your state for resources or organizations that are doing that work. And so with that, Brianna, did you have anything else to add? I know it's a hard one.
No, as Jessica said, and you have said too, it really does vary city to city and state to state. We see in California a push to open up, basically vacant hotels at this point, community centers, public spaces like libraries, all these mobile homes. Like there are some efforts of around this, our communities mobilizing to take these spaces that have been closed off to people facing housing insecurity to now be that space. But it's not something that it was not a solution provided for by, I think, like a lot of legislators. It's been community mobilizing around this issue, pushing local, state, and at the federal level with the next package, pushing for these regulations, these emergency policies to provide shelters for housing insecure populations. That's about it.
Thanks, Brianna. So Jessica, this next question is for you. So unemployment is at an all-time high. And so I know that the CARES Act did something with paid leave. So what happened and how have things changed?
Yeah, so the paid leave provisions are a little complex. So in the second COVID package, there was an attempt to really kind of overhaul our paid leave program. And then some minor, quote unquote, amendments had to be made to that in the third package, which have impacted the strength of the paid leave requirements, but they're still far better than they were before. So the CARES Act provides employees of covered employers 2 weeks of paid sick leave at the employee's regular rate of pay. If the employee is unable to work because the person is quarantined or experiencing COVID-19 symptoms. It also provides 2 weeks of paid sick leave at 2/3 of the employee's regular rate of pay if the employee is unable to work because they're providing care for someone else who is in quarantine or care for a child. And in this instance, a child is considered anyone under the age of 18. So, and then there's the bill includes an additional 10 weeks of paid expanded family and medical leave at 2/3 of the employee's regular rate of pay for an employee who was already employed for at least 30 calendar days before the pandemic was identified as such and is unable to work because of a need to care for a child, again, 18 years of age or younger, and this would be because the school or the child care provider is closed related to COVID-19. So the paid sick leave and the expansion of family and medical leave does apply to private employers with fewer than 500 employees, as well as some public employees. And so this is where there was some frustration around this bill. We recognize that there are many individuals who work for large corporations or organizations that employ more than 500 employees. And so there's ongoing work to ensure that more people can be included in these paid leave provisions. Also, I just want to acknowledge that a lot of the programs that we've talked about do leave out the undocumented communities across the country, and the paid leave is, again, one of those places. And then also small businesses that have less than 50 employees can qualify for an exemption from the requirement to provide paid leave because of school closings or childcare center closings, if they can prove that it would jeopardize the viability of the business long term. And so again, this is something else that was kind of carved into the package, and we're pretty concerned about because there are plenty of us who work for organizations with less than 50 employees. And then at one point, I think I referenced eligible employees, and those, you are considered an eligible employee if you are an employee for one of the covered employers and you're eligible for the 2 weeks of paid sick time for COVID-19 related reasons. Employees employed for at least, again, 30 days are eligible for the additional 10 weeks of paid family leave. So a lot of changes to the paid sick and family leave provisions under this current environment, and likely, quite frankly, more changes to come.
So some of those holes sound big enough for a number of workers to just fall through. Is there anything our folks can do, like to help have a more robust paid leave?
Yeah, I mean, I think it's really important. My little call to action is to let your federal, state, local legislators know how you're being impacted during this time. If you are an individual, particularly who falls into one of the cracks that we just identified, it's really important for your legislators to hear from you. It doesn't have to be anything wildly formal or anything like that, but just sharing your experience and your story goes a long way, as this legislation is being crafted. And we know that there will definitely be a fourth package related to COVID-19. And so there's a lot to be done still, and we have to make our voices heard as loud and clearly as possible, that folks are being left out and left behind, and that we're all going through this pandemic together and we all need support.
Yeah, thank you so much. All right, our next question is a really hard one, and it comes to you, Brianna. Are jurisdictions considering or already performing surveillance of both HIV and COVID-19?
Yes, great question, and very alarming one. So right now we know that states or state public health departments have created or are using existing databases to track COVID-19 cases. What's really alarming is how there are some states that are passing emergency legislation sharing this data with agencies like law enforcement. We've already seen in Massachusetts and Alabama that both of these states have policies in place right now where people who have tested positive for COVID-19, their addresses, but not their names, are shared with first responders. And the rationale underneath that is to protect first responders from getting COVID-19. But we all know that that's just not a thing. Like, the policy is not predicated on that. It's predicated on an outdated understanding of COVID-19. As in, you can be asymptomatic and have the virus, right? And so there's a lot of issues with these policies that put individuals, privacy, patient privacy, and safety in jeopardy. So databases are a thing. This information is being collected at the state level. However, our primary concern is with data sharing. Who has access to this? How could it possibly leak, and how this information can be used to potentially, harm an individual. So yeah, it's kind of where we're at.
All right, thank you so much, Brianna. Okay, and then the last question here that we got from you all. There's a lot of misinformation out there. Where can I go to get factual information, and how can I be sure that the info that I'm sharing is factual? This is something that came up on our national membership work group, so I'm going to try my best to recap what our comms team went over. So there is indeed a ton of misinformation going around. It's really important that you double check your sources. You can always go to someone you trust, like hopefully PWN. We do try to vet all of the news links that we post. So if you see it out there, the information is safe to trust if it's from PWN, because we always try to really make sure that we're sharing accurate information. For things like statistics, when they become available, or maybe an updated FAQ, you can also check out the World Health Organization or the CDC. It's also helpful to do a quick Google search before you share anything. If the information that you're sharing is on point, other news sources that you know and trust are going to be covering that story as well. So it's a real concern if you're not seeing other news sources covering it. Does anyone have anything to add on that? Okay.
I think so. I saw one question earlier in the chat box about information for domestic violence and sexual assault survivors or who may be experiencing violence during the pandemic. And speaking of credible resources, I wanted to share a link. The Futures Without Violence has a kind of a running list of resources for survivors and individuals who are experiencing violence during this pandemic. It includes the 24-hour National Domestic Violence Hotline, as well as a ton of other resources for Native individuals, trans individuals, people who are deaf or disabled, people who are parents, so on and so forth. So I will share that link in the chat, and hopefully that can get shared on the Facebook as well. But I think it's a helpful resource with a lot of kind of technology guidance, as well as some of the shelter care and homelessness that we were discussing earlier.
All right, awesome. Are there other questions? Okay. Okay, so we have a question up here that is asking, so let me get back to, I say the actual question. So the question is, why isn't there any lived experience represented on this panel? And we're going ahead and making the assumption that that means, why isn't there any lived experience of people living with HIV on this panel? And so I'm gonna pause here and see if Brianna, you wanna say anything?
Sure. Yeah. So these questions that we've been answering, PWN sent out a Google form to our membership. We posted on our public social media and I believe our respective chapter pages, asking our membership to ask as many questions as they'd like on the CARES Act and COVID-19. So I would say a majority of these questions did come from our membership, who are women and people of trans experience living with HIV. So we definitely don't want to ignore that. But obviously, if there are ways that we can improve representation, yeah, we will of course do so. So thank you for that question. But we definitely wanted to clarify that these questions do come from community, and we wanted to respond to those questions.
Yeah, and I'll say that the impetus for this Facebook Live itself came from the National Membership Work Group, where we were hearing a lot of questions, and a lot of our organizing folks were hearing questions as well. And we wanted to make sure that you all had the answers that you needed. And so, yeah, with that, are there any other questions that came up in the chat box? Jessica, anything else that you saw that we should respond to? Carter, sorry. Two Jessicas on the line. All right, well, not seeing any other, I'm gonna go ahead and give us some outro music as well. And with that, I will say goodbye to you all. And thank you so much to Brianna and Jessica. This was really cool. And to all the folks from PWN out there, you can always email the policy team with questions that you have. We're here for you. All right, thanks everyone.